My name is Frank. I'm with Iowa Donor Network. There's over 113,000 people waiting for solid organs right now. So there's a huge national need. There's almost 700 waiting in Iowa alone. A lot of it for dialysis back there are people waiting for kidneys. 75% of the waiting list is waiting for kidneys. So for every patient that meets clinical triggers, meaning they've lost 2 or more brainstem reflexes, they're vent dependent, and it's not a survivable injury, we're going to come in and evaluate that chart and work very closely with the nurse, the neurologist, and there's your neuro, and pulmonology and everybody else involved to see if this patient's suitable for donation, if there's anything that we can offer through donation, and then also work very, very closely with that family so they understand what their loved one wanted to do and they understand what their options were. Now, a lot of other people are going to be impacted by what's called tissue donation. Tissue donation, we're talking about all sorts of other stuff, from skin to vascularization to bone to connective tissue. Basically, anybody can be a potential donor, regardless of their age, their race, or their medical history. The oldest donor that we had just recently was over 98 years old. So never automatically assume, oh no, they can't be a donor because they're too old. Anybody can be a donor. 1 in 10 of our donors is going to be over the age of 65, and that's only continuing to increase. One tissue donor, and this number we can even change a little bit, on average can benefit 80 to 100 different people just through tissue and organ donation. That's an average. So if we have a 98-year-old gentleman who's a tissue donor, we may only be able to recover 2 or 4 grafts from him. But on the other side, we may have a younger donor that, let's say they passed away in a car accident or something. You're looking at, 200, 300, 400 different grafts that we're getting from one person. So the impact that they have on the recipients, and then also the family that's getting these letters back saying thank you for your loved one's gift, is just huge. Each year, 1.5 million surgical procedures are done using transplantable human tissue. All these different things, whether it be orthopedic surgeries, ENT maxillofacial, urology, peripheral vascular, all these different specialties are using transplantable human tissue in one way, shape, or form. Each day, 18 people die waiting for an organ transplant. So our list is continuing to grow, and we're losing people too quickly while they pass away on that waiting list. And on average, 118 people are added to the national organ transplant list each day waiting. That's about 1 every 12 minutes. So I'm in here talking to you guys for, let's say, a half hour. We'll add 2 just while I'm talking alone. I mean, the numbers are staggering. So the process. We'll talk about callback information. We'll talk about a document of gift. What would a document of gift be? Advance directives, last will and testament, donor registry, things like that. These are things where people have made their wishes known or their legal decision to donate known. Especially in the ER, fluids given in the last 24 hours is huge because we want to make sure that our patients aren't hemodiluted. If we're trying to make sure that our tissues are safe for transplant, we're going to use a blood sample. If our patients received a lot of product, we don't know if their blood is actually safe to pass on to somebody else through those transplants. Does that make sense? So be very, very, very specific. And then medical record number, because that medical record is then going to become part of somebody else's chart as well. Based off that, 2 out of every 3 people have made their wishes known on Iowa Donor Registry. And that's all the entire population of Iowa. How many people does that equate to? 66% of Iowa's population equals? It's over 1 million people are registered in the state as organ, tissue, and eye donors. That's a lot of people. Licenses run on a 5-year cycle. In 2007, they updated the information to change a little bit what the driver's license has on it. It went from having a word that said org yes to now it says donor yes. Org was specific to organ donation. Now it includes organ, tissue, and eye. The difference with this is, so if you guys forget everything else I say today, go home and just tell your families what you want to have happen. Because it does, even though I can share with them what you want to have, what your legal decision was, it means a lot more coming from you than it ever would from me. So again, when I come on site and I know that somebody's going to be a donor and they have their information with them, I'm going to share it with the family. That kind of leads us into what we talk about with the family at times. So what can be donated? We talked about the heart, the lungs, the liver, the kidneys, the pancreas, and small bowel. 8 organs can be moved and lobed and sectioned in different ways to help up to 11 to 12 different people, depending on how the organs are used. Okay? The kidneys and the liver are the only ones that actually can use donated through what's called living donation. They're the things where you hear about, let's say a mother or father donates a part of a liver or a kidney to a loved one, vice versa. There's also what's called Good Samaritan donation, where somebody will just go to a transplant center and say, hey, I want to donate my liver or kidney to somebody that's on a waiting list. Every once in a while you see those people show up like on Oprah. They can actually match them up across the chain, which is called domino donation, where you, let's say that, what's your name? Nicole. Let's say, do you have a brother or sister? Which?
Brother.
Okay. Let's say Nicole wants to donate a kidney to her brother, but she doesn't match. They don't have the same blood type. They don't have the same antigens, whatever. And I want to donate to one of my sisters, but I'm not a match for them either. But it just works out that Nicole is a match for my sister and vice versa. So they take us both in the operating room at the same time. That way Nicole can't change her mind after her brother gets hers. And simultaneously they remove the kidneys and then transplant them into our siblings. And it's called domino donation or pair donation. And what they do is with domino, they can actually move it out, 12, 13, 14 different people. And those are the groups that came on Oprah last year, where there's like 15 different people that went through the whole donation process, where they matched up people kind of across the board to match their organs or kidneys or whatever they needed. The heart, the lungs need to be transplanted within 4 hours. So if we recover it here, we're going to go within a 500-mile ring. If we can't find it within the first 500 miles, then we have to go out another 500 miles. But it's going to usually be somebody very close to Iowa or a state touching Iowa. Livers, pancreas, and small bowel have to go within 6 to 8 hours. Usually when you're talking about small bowel and pancreas, they're usually going to be paired with something else as well. Let's say to a child that has like a birth defect. So the pancreas and small bowel and the kidneys will all go together in a group. And then so these all have like a smaller time frame in which to go through, but larger than what the heart or the lungs would. And then the largest one is the kidneys. Kidneys can go out to 12 hours to be transplanted. So the kidneys could actually go to New York or, wherever. All right, tissues. Different things that can be recovered. Bone, connective tissue, skin, heart valve, saphenous vein, femoral veins, fascia, costal cartilage, adipose tissue, all different stuff that's going to impact all these different specialties. So like bone, let's say that we have somebody that has to have a tumor resection, or a section taken out of their bone for whatever reason, or a little kid that gets hit by a bike, or hit on his bike by a car, and has the bone is just completely shattered. The next x-ray you see of the little kid would be a full section of bone with a titanium rod running through it. Where's the bone come from? It's donor bone. When they take that section of that bone out because of the tumor, and they put another section of the bone back in, where does it come from? It comes from somebody that made a choice to make the gift to somebody else. But connective tissue are the things when somebody blows out an MCL, ACL, PCL, Achilles tendon, even stuff in the shoulder and elbow. These are the connective tissue that we use for those surgeries. Skin I'm going to come back to in a minute. Heart valves, what would those be used for? This is an easy one. Talk about softballs. Don't shout it all at once either. Valve replacement. Very good. Saphenous veins, what would those be used for? I got him in the back. Bypass surgery. They use your one in your one leg for the first bypass surgery. If you ever need another one, they're not going to take it out of your other leg, so they're going to use a donor vein. Femoral veins are used in chemotherapy patients to hold the ports. Costal cartilage they can use to rebuild noses or ears. Let's say somebody was mauled by a pet or somebody else's pet. They can actually rebuild facial structure to that. Adipose tissue. Why would we recover adipose tissue? This is an easy one too. And we're not going to transplant the adipose tissue into somebody else. That's the easy part. Basically what you have is the adipose tissue is the home to what's called mitochondrial cells. And there's these mitochondrial stem cells we can place with something else like bone or skin or connective tissue, and it will actually convert to whatever tissue you put it with. And it will invigorate the body to grow that type of tissue faster. So it just aids in the healing process. So all those different things. And then skin. Skin is a huge one because most of our donors can be skin donors. The width, I'm going to steal your paper for a second. The thickness of the skin that we recover is sometimes less than the thickness of a sheet of paper. It's recovered from the thighs, it can be recovered from the abdomen, it can be recovered from the back. Now Joni has that huge tattoo of an eagle on her back. You guys ever seen that? No? Well, if she's a skin donor and she has that huge eagle tattoo, it doesn't mean that somebody's going to wake up, little kid's going to wake up with an eagle on his chest and go, hey mom, look at me, I can make the wings fly. It doesn't work that way. But they could still be a skin donor, either if it's deep enough and done in a normal sterile setting with the tattoos done, we can recover over it and not have that tattoo go with it. Or if it's within question, we can actually recover around the tattoo. But most burn units are made up of what age patients? Pediatric patients. 80% of a pediatric burn unit is going to be made up of pediatric patients. So that means that skin is going to go to a younger person. So when I can go into a family and say, did you know that when you donate skin, Your father, your grandfather, your husband that's 85 years old and has a very long life, by donating his skin, he may be able to save the life of a child. Because let's say that they're even burned, and we'll use the theories of 9. Let's say they're just burned on their torso. So 18% of their body, let's say maybe it wraps around a little bit to their back and maybe under their arm. So let's say navel to nipples and around. They're going to graft their own skin up from their legs most of the time to cover this area. But they may not have the ability, especially they're not going to roll them to do their back, they're not going to roll them to do their arm, so they'll graft the abdomen first. So they wait another 5 to 10 days for the skin on their legs to heal before they graft it to the back. And then another 5 to 10 days to wait for the skin to heal again on their legs before they'll graft that same skin back up to their arm. So that's 3 or 4 different surgeries that the kid's going to undergo. And this whole time they've had all this other bad skin, the burn skin, debrided. And so now they have no way to regulate their body temperature, no way to control their fluids, no way to keep infections out, no way to prevent other bed sores or anything like that, except for that donor tissue. That donor skin is used as a temporary graft to keep them alive while they're waiting for their own skin to reheal before they can have another surgery. And if you can explain that to a family, I've never had a family come in and say, oh no, I don't want to help a little kid. Because you have to give the ability, it's called dual advocacy, letting families know who's on the other side waiting and giving them a face, giving them kind of an idea of who they may be helping in that process. Now, it doesn't always go to kids, but a lot of times it does. The other things they can use skin for, too, can go to breast cancer reconstruction. For somebody that's had to have a mastectomy, they can go to cleft palate surgeries for, correcting the birth defects and stuff like that. So there's so many different uses for skin. And it's huge. And it makes a huge impact on the families when they know there's somebody direct that they can kind of attach to. The eyes, most of the time we're recovering eyes through a procedure that's called in situ. It's very much like a LASIK procedure. They just recover the thin layer of the cornea they need. The sclera. How many people ever had a mom say, don't run with a pencil? Anybody? This is the mom injury. The sclera is recovered in case for like a puncture wound. Somebody pokes themselves in the eye with a pencil. Somebody's working, weed eating their yard and they hit a rock or something that flies up, hits their eye. They can actually take the white part of the eye and quarter it out and then give that to the patient that needs it. And then they can also recover whole globe, which is used for research. Any questions about any of those? So the big thing up there is at the very top. In the U.S., 15 to 20,000 of all deaths each year are brain deaths, meaning somebody's lost all their brainstem function, they're declared legally dead in order to be considered an organ donor. But that's less than 1% of the entire population that passes away across the nation. Less than 1% of the time do we ever have the opportunity even to offer organ donation to a family. That's why that list is growing so fast. So organ donation is very, very rare. When I go in and talk to a family, what do I say? And so we talk about a whole bunch of different things. One of the big ones I'll share is whether or not they were on the registry. But the families are very concerned. They've been there a couple days. Is it going to cost anything for me to be a donor? And the answer is no. There's no cost for somebody to become a donor. It's all based off, once they sign consent, whether it be lab tests, whether it be hospital stay, whether it be physicians that come in and do different tests for us, whatever it would be, I'm responsible for those charges, and then we get reimbursed after the fact. But the family's not responsible for any costs associated with donation. Another big one is disfigurement. I want my loved one to look how they look now, or did then. Are they going to look different because they've been a tissue donor or an organ donor? And the answer is no. You could lay somebody down that was a tissue donor down next to somebody that wasn't and not be able to tell the difference. Funeral arrangements delays. That's the big concern too. Am I still going to be able to have a normal funeral? Would you be able to, is this going to slow me down anyway? And the answer is no. Most of the time we're completing the case within 24 hours. So most of the time the families aren't going to be slowed down at all. I mean, if they need to be buried by 6 p.m. the next evening, then yeah, that might be a hindrance, but we'll work around it. But for the most part, we're working directly with the funeral homes, and it's a very quick process as far as the family is concerned. They will be presented in a way just like they would at any other visitation or wake. Most of the time, if families are going to have them buried in like a long sleeve shirt or a jacket, they'll still visually look the same. If they're going to be buried in a short sleeve shirt or a jersey, let's say we have a younger person that wants to wear their football jersey, we'll let the family know that maybe you don't want to do long bone recovery of the arm because you'd be able to see the suture marks. And that way, they'll still look the same. Because even if somebody is a long bone donor and has on a long sleeve shirt, if they were to feel the arm, you can feel the difference a little bit, but you wouldn't be able to see it. We talk about religious beliefs. So a lot of families will say, I want to be a donor, but it's against my religion. There's currently no religions that are actually against donation. A lot of them have doctrine that says it's up to the individual's choice. We do pay very close attention to like different cultural beliefs, though. Whether they need to be buried at a certain time, whether a recovery team needs to be made up of a certain gender. Even like, let's say in some Native American cultures, the chief of the tribe would actually be considered the legal next of kin. So who am I talking to get permission to proceed with donation? The big one, and this still comes up about 50% of the time, which I put in there just because it's more of a laugh. If you have a yes on their driver's license, the ER is just going to kind of stick you in a corner and let you die. Because you want to be a donor, we don't need to worry about your hospital care as much. So, and that's one that they said, hey, you guys have done everything you can throughout the process. This is just the next step in the process. Somebody's going to pass away. This is just the next step. Buying and selling of organs is illegal in the United States. It's also illegal in China, which really killed one of my jokes. But you can't get onto eBay and say, hey, I want a kidney. Well, you probably could. However, it would probably be from an animal, or it would be the wrong blood type, or it would be the wrong size, or it would be the wrong, you'd need a left, it would be a right. So you just can't do it. And it doesn't matter if you're, Lindsay Lohan or, whoever else, just because they get followed around by paparazzi all the time, we would know that they need a kidney or a liver, but it's not going to move them up the list any faster. Everybody's kept on that 113,000 list that I referenced earlier. They're all kept there based off their blood type, their antigens, all these different factors that gives them a score. So if somebody in Iowa passes away and they have a liver available, somebody in California that needs a liver that's just a famous movie star is not going to pop up that list that much faster. We're still going to try to find a home for that organ the same way we would with anybody else. And recipient selection. How do we pick the recipients? It's based off that MELD score that I just talked about. Based off their location. There's so many different factors that come into play. And there's no way to describe that for each organ that we have, we offer it to a physician. And they have an hour in which to review it, say, yes, I want that for my patient, or no, I don't. So you can imagine out of all the people that show up on the list, how long it may take to find a home for each organ. And you'd think some of them would jump at it like that, but a lot of times the people that we have, they may have one or two more issues going on than just the brain death. We don't have, in Iowa especially, very young, strapping, healthy people that just have a severe brain injury. It's people that are going to be older that are going to have a stroke or, something like that. We do work with the families for at least 18 months, whether they become a donor or whether we have to walk away from the case, because they made a commitment that they wanted to help somebody else through donation. And they've said yes, and they've gone through the process of completing paperwork with us. So we're going to check on them about every 2 weeks, by phone or by letter. We're going to let them know where the organs went almost right away. After the surgery, we'll let them know what states they did. After a couple weeks, they'll get another letter back saying, the kidneys went to a 44-year-old in Texas and a 24-year-old in Iowa. And they're on for whatever else was used. After about 6 months, they'll actually get a letter back from the recipients saying, hey, I'm a 24-year-old from Iowa. I just graduated from college. I am in the process of becoming a school teacher. And this is what your donation has meant to me because I spent, the past 4 years in dialysis because my own kidneys were shutting down. After a year, we'll actually facilitate the meeting between the two groups if both parties are agreeable. And it's not normally the donor families that don't want to happen, it's the recipients. Because they still feel guilty because they know for them to survive, somebody else had to pass away. But it's one of the neatest things that you can ever be a part of, is to be there when a donor family meets the recipient. To walk into a room and have a mom that lost her son or lost her daughter in a car accident walk up to the heart recipient and put her hand on the person's chest just to feel their child's heartbeat again. To walk and to get to meet the different people. There's a gentleman that we know from Chicago that received his lungs from northern Iowa. And the coolest thing, he loves to tell people where he's from because he's like, well, I'm from Illinois, but part of me is from Iowa. And then goes on his whole half-hour-long spiel about organ donation. But the coolest thing he says is he hated his entire life living in the Midwest because it was cold. And he said, after I got my lung transplant, he goes, my favorite days are the days when it's cold. You guys guess why he says that? What happens when you walk outside on a cold day? You take a breath, and what can you do? You can actually see the breath as it leaves your lungs. He goes, those are the only days I can ever see her and say thank you. I mean, it's just the little stuff like that that gives you chills every time you tell the story. And that's why it's so easy to do what I do,